It's been 38 years since Nigeria recorded its first case of AIDS. And over time, the story has changed from that of despair to hope, with focus shifting from treatment of AIDS to prevention of HIV, that's the virus responsible for its transmission. Abosede Adeniran Aderemi attended a workshop in Lagos and reports on the need to get tested and be intentional about telling positive stories of people living with HIV.
According to the National HIV and AIDS, Viral Hepatitis and STIs Control Program, NASCAP, Nigeria has an estimated HIV burden of 2 million people living with HIV, and there are currently over 2,000 facilities providing antiretroviral therapy to all populations in Nigeria, with about 6,000 providing comprehensive prevention of mother-to-child transmission, PMTCT services, to pregnant women, with support from private, multilateral, and bilateral agencies. With changes in the patterns and trends in the HIV epidemic in Nigeria, this 5-day training was held to improve the media's engagement in the HIV response.
In the last 5 to 10 years, we've had a lull in that. And we believe that that strongly accounts for the lull that we have in reportage of HIV and AIDS issues. And, the general public even believes that HIV is no longer a thing in Nigeria.
We need to go back to the origin, the community response, to get people to understand their status.
How is Nigeria faring with the United Nations 95-95-95 target of HIV testing, treatment, and viral suppression?
The concern remains that we have to continue to create an environment where people feel comfortable to come out and access the services.
We also expect to see that donor funding will be restructured. So rather than wait for that to happen, we need to look at how we're doing things and restructure it so that it is a program that is sustainable.
Participants share their experiences with a commitment to spreading the message further.
One of the key things we need to understand is to clear assumptions.
We're able to learn, to unlearn what it is, the preferred word to use.
I've lived with HIV for over 22 years and I'm still doing well, and I'm healthy, and I'm fine, and all my children are fine. And so I will employ the media to see a way around segregating information, I'll be passing information in a very positive manner.
The consensus at this workshop is that HIV is a community responsibility. As such, all hands must be on deck in eliminating the biases that prevent people living with HIV from accessing care. Abosede Adeniran Aderemi, TVC News, Lagos.